Cervical cancer. The very words can evoke fear and uncertainty. This disease, often silent in its early stages, affects the cervix, the lower part of the uterus connecting to the vagina. It's a condition that can go unnoticed for a long time. Cervical cancer develops when cells in the cervix grow abnormally. These abnormal cells can eventually form a tumor. This abnormal growth is often slow, occurring over many years. It can take a decade or more for these changes to become cancerous. Initially, there might be no noticeable symptoms. This is why regular screenings are crucial. As the cancer progresses, abnormal vaginal bleeding, pelvic pain, or pain during intercourse may occur. These symptoms should not be ignored. However, these symptoms can also indicate other health issues, highlighting the importance of regular checkups. Early detection through Pap smears and HPV tests can save lives. Understanding cervical cancer is the first step in prevention and early intervention. Knowledge empowers us to take action and protect our health. The human papillomavirus, or HPV, is a common sexually transmitted infection. It affects both men and women, and can be spread through intimate skin-to-skin contact. While many HPV infections go away on their own, some can persist and lead to serious health issues. High-risk strains of HPV are the primary cause of most cervical cancers. These strains can cause changes in the cervical cells, which, if not detected and treated early, may develop into cancer over time. Regular screening through Pap tests and HPV tests can help detect these changes early. Early detection is key to preventing the progression to cervical cancer. Other risk factors can increase the likelihood of developing cervical cancer. These include smoking, which can weaken the immune system and make it harder for the body to fight off HPV infections. A weakened immune system, such as from HIV, can also increase the risk. It's important to maintain a healthy lifestyle and manage any chronic conditions. A family history of cervical cancer can be another significant risk factor. If you have close relatives who have had cervical cancer, you may be at higher risk. Long-term use of oral contraceptives has also been linked to an increased risk of cervical cancer. It's important to discuss the benefits and risks of contraceptive options with your healthcare provider. Knowing your risk factors and discussing them with your healthcare provider is crucial for effective prevention strategies. Regular checkups and open communication with your doctor can help you stay informed and proactive about your health.
The good news is that cervical cancer is highly preventable and treatable, especially when detected early. Regular screening tests are essential. The Pap smear detects abnormal cells in the cervix, while the HPV test specifically identifies the presence of high-risk HPV strains. These tests are simple, quick, and can literally save lives. Early detection dramatically increases the chances of successful treatment and survival. Talk to your doctor about the appropriate screening schedule for your age and risk factors.
Section 4. Life after diagnosis, a journey of healing and hope. A cervical cancer diagnosis can be overwhelming, but it's not a death sentence. Treatment options depend on the stage of the cancer and may include surgery, radiation therapy, chemotherapy, or a combination of these.
The journey after diagnosis involves physical healing as well as emotional and spiritual well-being. Support groups, counseling, and mindfulness practices can be invaluable resources.
Remember, you are not alone.
Section 5. United in strength, support, advocacy, and the future. Navigating life after cervical cancer involves ongoing care, including regular follow-up appointments, a healthy lifestyle, and emotional support. Survivors often face unique challenges, but with the right support system, they can lead fulfilling lives. It's crucial to stay informed about the latest advancements in treatment and care.
Local organizations provide a lifeline for patients and their families, offering information, resources, and a sense of community. These organizations host events, workshops, and support groups that help survivors connect with others who understand their journey, and a sense of community. They also advocate for better healthcare policies and work tirelessly to raise awareness about cervical cancer prevention and early detection.
Awareness, education, and compassion are paramount. By sharing our stories, we break down stigma, encourage early detection, and support those facing a diagnosis. It's through these shared experiences that we find strength and hope, and compassion are paramount. By sharing our stories, we break down stigma, encourage early detection, and support those facing a diagnosis. It's through these shared experiences that we find strength and hope, and support those facing a diagnosis. Together, we can create a future where cervical cancer is no longer a threat.
Let's continue fighting together, supporting research, raising awareness, and advocating for increased access to healthcare. Our collective strength can make a difference in the fight against cervical cancer. By working together, we can ensure that everyone has the resources and support they need to thrive, and advocating for increased access to healthcare. Our collective strength can make a difference in the fight against cervical cancer. By working together, we can ensure that everyone has the resources and support they need to thrive.